So as a reconstructive pelvic surgeon, I see women day in, day with prolapse, and it reminds me of a woman I recently took care of who had symptoms. Initially, she noticed that she had to lean forward, lean back to empty her bladder. All of a sudden, she had to strain really hard to keep her urine stream and to pee, and also to have a bowel movement. She noticed she had to strain, and even after she emptied, she didn't feel like she was completely emptied. She noticed some more pressure in the lower pelvis and the vagina and some back pain. Sex was becoming more uncomfortable. She was just starting to know actually more urgency. She had to go to the bathroom more frequently, was waking up more often to empty her bladder at night. All these things were happening, but she didn't feel anything until in the shower actually felt a bulge down below. And that's when she was alarmed because she wasn't sure exactly what it was. And then she saw me, and after a thorough exam, realized that she actually had what we call a cystocele or a drop bladder. And this really alarmed her. She was not interested in anything else except surgery. She actually wanted to fix it, but she wasn't sure what to expect after surgery, and so she was a little hesitant. And so in this video, I want to create a video that describes exactly what to expect after pelvic surgery, specifically bladder surgery. We talked about her options. She was not interested in physical therapy. She was not interested in a Pessary device. She actually wanted surgery. She wanted to fix it. However, she didn't know what to expect from surgery. And so I created this video to explain exactly what recovery from surgery looks like and top tips to really recover the best way from surgery. Dr. Tugbiyele here, board certified, fellowship trained urogynecologist, top doctor in urogynecology in Atlanta. And again, I've cared for thousands of women who have prolapse or a bulge down below, particularly a vaginal bulge from dropped bladder. And while there are many different options for taking care of this, there are vaginal surgery options, laparoscopic, robotic surgery options. The recovery is something that a lot of women are not sure about. So in this video, we're going to talk about what recovery from bladder surgery looks like and top tips to actually recover the best way from surgery. And so with bladder surgery, usually I tell my patients that the recovery, typically it's an outpatient procedure, meaning women go home the same day. I say the recovery has different milestones. So I will say 2 days, 2 weeks, 2 months. So typically the first 2 days when you get home, typically is when we allow the swelling to subside. Usually the discomfort that women feel is very minimal. It's like on the order of 1 to 3 out of 10. It's definitely not 8, 9, 10 out of 10 pain. Once the first 2 or 3 days goes and the swelling's down, discomfort's down, very minimal need to take anything for discomfort above and beyond. Oftentimes there are ibuprofen if a woman can tolerate it, or usually after about 2 or 3 days, women are not taking anything for discomfort. Walking is fine. Stairs are fine. Usually after first 2 or 3 days, again, that's when you can resume driving comfortably, especially with bladder surgery, vaginal surgery. You're going to be sitting behind the wheel for an extended period of time. It's important to allow that swelling to subside. Make sure you're not taking pain medicine that's going to make you drowsy, that you're more comfortable. And usually after 2 or 3 days, you can start driving short distances, actually. And I tell my patients that you're going to go grocery shopping or run an errand. In terms of lifting, making sure what you're lifting is not more than 10 to 15 pounds. And these are general guidelines. So a gallon of milk or a gallon of water is about 8 pounds. So usually I'll say, not to lift anything much more than what would seem like a gallon in each arm. And that would be, up to 15 pounds at the most. Showers are fine. Oftentimes there are incisions in the vagina and sometimes around the vagina area and inside the vagina. So showers are fine. Allow the water to run, soapy water, and pat those incisions dry. But what we don't want is for those incisions and sutures to get immersed in water. So swimming pool, jacuzzi, hot tub, sauna, bathing, all those things we have to kind of put on hold until the sutures have completely dissolved. Usually by 1 to 2 weeks, women feel great on the outside, but there's still a lot of healing going on the inside. So usually there's a 2-week post-op check where we initially check the incisions and make sure things are healing well, but it won't be until somewhere between 6 to 8 weeks before you're able to resume all your usual activities without restrictions. Now I tell my couples that other forms of intimacy outside the vagina are fine, but just nothing inside the vagina while the sutures are healing. And so again, 2 days, 2 weeks, 2 months. But then after 2 months, typically you'll feel better. Your energy typically levels are back to normal. You can resume all your usual activities without restrictions, and you feel great. And that bulge is gone. The pressure is gone. You can empty your bladder better without having to strain or lean forward or lean back and do all these things. And so women are definitely much more comfortable after having their surgery. And so in terms of recovering well, you want to eat well, get a high protein, balanced diet, but definitely high in protein is good. For wound healing, stay hydrated, get your rest. It's not uncommon for you to feel a little more fatigued in the initial days, weeks of surgery. So make sure you can take your naps in between. Again, getting a good nutrition is good. Good rest is good. Avoiding heavy lifting. And those are kind of the basic things I would say that are going to really help you heal well. Getting a good balanced diet is also very, very good. And so in terms of healing, a lot of women have prolapse, don't know that they're good and safe options. And again, your women listening to me right now, there are good and safe, effective solutions for surgery. And for those women who prefer to have their surgery versus other options, yes, these surgeries are effective, safe, and they can help to restore your confidence, comfort, and quality of life. And so if you are listening to me right now and you know someone who can benefit from this video, please do share, like, and share the video. And because a lot of women live with this problem of prolapse or a dry bladder, don't have to. They're good, safe, and effective solutions. And so do share it with her. She really appreciate you for it. If you haven't subscribed to my YouTube channel, please go ahead and do that right now. And hit the notification button so that you will be notified when I bring out future videos, educational videos. Again, if you're a woman listening to me right now, or you've been told you have a prolapse bladder, and now, of course, no one wakes up in the morning and says, oh, I want to see the urogynecologist, and oh, I want to have surgery. However, it seems like surgery is your next best step. Know that you don't have to live with it. I've cared for thousands of women successfully over the last 20 years with a prolapse bladder. And so if you are looking for a urogynecologist who will help diagnose the condition, take good care of you, and listen and fix it, I invite you to work with me. The one way to reach me is through my website. That's www.drtugbiyele.com. That's www.drtugbiyele.com. That will be in the description. You can also call my office directly. It's 470-325-1280. Now imagine how you feel when this prolapse bladder is addressed. You can empty your bladder better without straining. You have better control of your bladder. The leakage is gone. The prolapse, the pressure is gone. And you notice your confidence is back. All these things are possible for you when you work with me. So I do invite you to work with me. Again, that's www.drtugbiyele.com. And the office number 470-325-1280. And I'll see you in the next video.